I am an emergency physician and was 30 years in practice. When I became ill, I had had lifelong problems with my feet, and another orthopedic surgeon had reconstructed my right leg, my right foot, and I had a lot of hardware in there. For some reason, in April of 2005, my foot became infected. I developed a severe infection in my blood and in my right ankle, and the bone was destroyed by the infection. I came to Texas Orthopedic Hospital and was admitted under another orthopedic surgeon who drained the abscess and began the antibiotics, and then called Dr. Brinker in to see if something could be done to save my foot. I had been told that I would most likely have an amputation. I have a son who's an orthopedic surgeon, and he felt that it would be likely that anywhere else I would have been amputated. And I wasn't happy with that possibility. I had a lot of things left to do in life. The 6 months or so before I became really ill, I was having a great deal of problems with my feet, mainly my left foot, which was scheduled to be redone. But I had begun to have a lot of pain in my right ankle also, and I got to the point where my right ankle was really the limiting factor in my ability to get around. In the last 6 months that before I got really sick and infected, I was in a wheelchair working in the ER. Of course, being a doctor, the night that I got sick, I recognized how sick I was, and that I almost certainly had a bone infection in that ankle, and I, in my own mind, had fears about losing my foot, and of course wondering what in the world I was going to do. It is definitely a unique perspective being a physician and being the patient. It takes a lot of patience to be a patient when you're a doctor. I think that the greatest thing of all was that Dr. Brinker was always very clear in telling me what was going to happen, what the probabilities were, what he was going to be doing, how I would look and feel, and what I'd have on me when I got out of surgery. He told me from the beginning that there was still a possibility that I would lose my foot, even though we were going to go through this bone transport process, and that the main concern early on was to control the infection. And he went in 3 times, I believe, cleaning out dead bone and packing the wound with antibiotic beads, called in a very good infectious disease consultant who got me on the right antibiotics, and after about a week had the infection under control and was able to put the Ilazar on. Well, life was difficult with that frame. I would go out on a daily basis, either in my wheelchair or on my crutches after a while. At first I really started with the walker, and you simply walk as far as you can walk the first day, and the next day you walk 10 feet further and turn around and come back, and pretty soon I was walking a half mile or so every day, and that was about probably two or 2.5 months after I got out of the hospital. It was not a painful process, by the way. I've used very little in the way of pain medicines during the whole time. Very little pain. That may be why I let my ankle get so bad to begin with, because I bear pain. I'd rather work than go see a doctor. He kept me informed all the way along, and I really appreciated that. I think as a physician, that's anxiety alleviating for me, and I would imagine that it would be for any patient. Oh, it was absolutely worth it. I don't think that I would be doing what I'm doing now if I had not had that frame on and had bone transport and and ankle fusion. I think I would have had to retire, and who knows? I'm not sure I'd still be alive. I would have laid around and vegetated, but it allowed me to become active, and I never became discouraged. And I think that a big part of that was that I don't think Brinker ever became discouraged. He was always upbeat and looking and positive at about what was going on with me, and I think that he never pulled punches and told me things that weren't true, but he always took the optimistic side of things, and that was very important to me. It seems to me in retrospect that those 2 years that it took me to go completely from being severely ill to being back to work went by very, very quickly. It was a very short period in my life. I learned a whole lot during that period. I learned a whole lot about being compassionate with patients, just by having Brinker be compassionate toward me.